Welcome to part 2 of your Cerner resident training. We're going to go back into PowerChart and pick up where we left off from part 1. So I'm logged back in here as a resident in our train environment. And before we get back into the patient's chart, I want to show you this physician handoff tool. I know a lot of our medicine teams use this to hand off at the end of their shift and get a summary of what's going on with their patients. So I go up here to my toolbar and I click on Physician Handoff. I'm going to dismiss this blue line alert that tells me I have to pick a patient list in order to see any patients. And from the drop down of Select List, I'm going to choose my custom Angie's list. Once our environment is done thinking, it's going to pull up those patients on that custom list. Notice that you could quickly add a patient from here. If you're not seeing information that you think you need to, you can establish relationships by clicking this button and establish your relationship to any patients on this list as appropriate. But we've already established our relationships here, so we don't need to do that. If I click this little arrow to the right of my patient's age and gender, I get what's called our iPath. So this is more detailed information on your patient, where you can fill out additional information. So we've got our code status, our length of stay. We have our illness severity. So we're going to make this a patient to watch. Notice that as we change their illness severity, it has a color associated with them. And this is how you can kind of prioritize your patients to see. In the patient summary, this should be about 2 to 3 sentences about how the patient is presenting. So for example, we're going to put in today, to go along with our scenario, that the patient was admitted with chest pain. And that they're a rule out MI. We'll click Save to save this to the report. Under Actions, these are kind of your to-do items to do still on your patient. For example, we're getting ready to hand off, and so we want to make sure that the next team knows to check proponents tonight at 2100. And we're going to save this as well and see how it becomes a little checklist. And just excuse my misspelling. In the situational awareness where you can type some situational or pertinent information that's needed for taking care of the family. For example, it could say if chest pain increases from repeat EKG and troponins. You can also do things such as family is highly involved in patient's care. So one thing to note is that all of the information typed into here is very discoverable, so we want to make it pertinent to the patient, yes, yet also cautious that it's appropriate. So be careful what you type here. You can also use these items to check out any clinical data, vital signs, labs, medications, I's and O's that pull in. And then the care team isn't something we typically look at, but you could see if that information was there, who was on that patient's care team. So we're going to click the white X over here on the right-hand side to close this iPass detail. When it refreshes, you'll see that our illness severity has changed to that watch status. And you could sort your patients by any of these columns. So if we had a long patient list, we could definitely sort by illness severity, for example. Once you're done editing this, you can print it by going over here to our 3 little lines with the down arrow again, our hamburger button. When we click on that, instead of a components list or editing details, we actually see where we can have an option to print. We want to make this a detailed report, and then we would select all patients that we want on that report. Today we only have one patient, but you would select what's appropriate. And we'll click continue. And then notice that it pulls you a report that when we expand, we can see all of those details that we typed in. We can see their medications, those action items, the situational awareness, the patient summary, along with some allergies and patient demographics. You would come up here to the print button, select your printer, and grab it off your copier. Today, we're just going to click exit and get us back to that patient physician handoff. So the reason I wanted to show you here before we hopped in is that you can actually, from your physician handoff, you can go directly into the patient's chart by clicking on the link that is their name. Again, we're going to get that duplicate name alert and any other alerts that you would have gotten if you went into the patient's chart in another route. Now, this time we're not asked to add a relationship to our patient because we've already been in their chart before and we've had that relationship established, and that sticks on the chart for several hours. So now we're going to go kind of through this menu bar and show you some different options that are available in your chart for viewing things, documenting, and seeing other data. So we've talked about our provider view already. Next is our results review. This is where we can manage and view lab results. So we're brought to our most recent results, which includes our vital signs, height and weight, in some labs. You can change the time, which is displayed here in this gray bar, by right-clicking and going to change search criteria. So right now we have the clinical range posted, but we could do admission date to current if you wanted to see everything since that patient's original admission. We could do result counts, so a certain number of results within the last year. Or we could do a specific posting range, which would be, let's say you just want to see information for the last 2 days. You would change your from, we could change it to T for today, and in for now, and hit OK. And it would then show us only data for the last day or 2 days. If we go to our labs recent, it's going to give you just your most recent labs versus labs extended is a longer view of those labs. Within the labs tabs, you have 3 different view options. It defaults to this table, which is nice for grouping labs in certain ways. You also have an option for group, which would put your groupings of labs a little better. And then a third one is list. This is really nice for students and for anyone that's kind of has a new appreciation of lab work and is wanting to see the reference ranges right there on the front of their screen. Another way you could see those reference ranges or more details about this lab, went back to the table view, and you can double click on any one of these values and it'll bring up more details on that result. So you can see who collected this, entered the specimen, who collected it, as well as those reference ranges here. We'll close out of that. The next tab you have on your list is actually radiology. And the reason I point that out here is because you also have a radiology tab in your results review. It's just different. People prefer to see it different ways, and depending on your residency, you may need to get to your radiology quicker without having to go to that results review. Many people just use the tab from the results review. Just like you could do from your documents page, you can actually double click on this radiology result and see your radiology report from here. Again, if you had any images attached to this report, this little symbol here would be colored in, and you could click on it to see your images directly from Cerner if you're on site at ULH. We've already talked about orders, so the next one I want to look at is your documentation and reports tab. And we'll go back to this documentation ad. This is another way to look at the documents in a patient's chart. So it's defaulting to a specific date, which again, you can right click and change your search criteria. And then it has all these collapse folders. Now, as you start to double click through them, they'll expand. You can also use these arrows at the bottom to click and expand and go down and see the different notes. The nice thing about this view is that if you're looking for a particular note type, and maybe all you know that who it was performed by, you could filter by performed by, you could filter by encounter, by date, or maybe you just want to see any unfinalized documents, you could filter by the status there. You can also hover your arrow and move your bar out to the right or left, depending on where in this screen you need to see some additional information. So let's find that CR Chest 2 view again that we found in our results review. And let's say we want to tag this impression in order to bring it into our note later. To do that, we're going to highlight the information that we want to bring in. And when we unclick our mouse, we get an option to tag. So I'm just going to click this tag button, and it's going to save it for me to use in my note later. It's kind of like a copy. The next thing I'm going to talk about is iView INO. This is where nursing does most of their documentation, or if they're not doing it directly in here, where their nursing documentation flows. Now, when you first log in, you may only see the intake and output band is what this section is called, but we actually have a lot of different bands in Cerner built out, and you can add those to your chart very easily. To do that, you would go up to View while you're in iView INO. We'd go to the Layout, and then click on this button that says Navigator Bands. Just like we saw with our patient list, all of your available document types are over here on the left, and your current document types or the types you're using are on the right. So you can bring over, for example, the ICU Quick View. There are options for blood documentation, burn care, lines and drains, scales and screens, and pretty much anything you could want nursing documentation wise in here. So if I want to bring a band into my view, I would highlight it from the left, available documents, use the arrow in the middle to pull it over to current, and I would click OK. Now I'm going to get an alert that says I need to close and restart the application, but you can actually do this simply by closing and opening your chart. So I clicked OK on that alert. I'm going to close out of my patient chart. And then I'm going to come to my recents just to show you a third way to get into a recent patient chart or a patient chart. And I'm going to click on that patient's name. When I go back to iView INO, I now have that blood admin band for me to see. So I didn't have to log all the way out of Cerner. I just have to close the patient's chart and open it back up. MAR and MAR summary are just different ways to view the medications that have been administered on your patient. What's nice about the MAR summary is that it's a more condensed view. So it's not got every single medication timed out as far as marched out along a Q1 hour timeline. It actually tightens the timeline a little bit so you can see a more condensed view. In the orders menu, notice that you have a display here, and right now we're viewing all orders and all statuses. But you can click down and say that you only want to see active orders 24 hours back. When we toggle that, If we had any inactive orders that were previously on here, those would be removed from the list. You can also filter out to see all medications, any completed orders or future orders, and all sorts of different display items there. This is also how you can make sure that you want to see all your orders if a patient's been in the facility for a really long time. You don't feel like every order is displaying. If that's the case, you actually have a button in the bottom right that says show more orders. That would become active if you had orders that were kind of hidden due to the size of their order history. Also notice that you have several different icons on your orders. If you hover over the icons, you actually get definitions of what those mean. So we've seen the power plan icon, that little pizza box or block looking one. We have the eyeglasses, which means that the order is yet to be reviewed by the nurse. And you have the little medical caduceus, which means it's still to be co-signed by the ordering physician. And you'll see that co-sign action on orders that a nurse has put in, and they still need to be co-signed by the ordering provider. Also on our DNR and admission orders that need to be signed by an attending. Another symbol you'll see down here in your medications is the mortar and pestle, and that means that the medication hasn't been verified yet by pharmacy. And you'll notice that your cosign order refusal has that cosign symbol, but it now has an exclamation point next to it. So there is some indication on the chart that the order's been refused, but notice that it is still on the chart. It just has not been properly cosigned. So we're going to practice just placing a single order on this patient's chart from this order screen. We're going to click our Add button. And we're going to add a CBC with AutoDiff. We're going to make this an AM collect and choose the appropriate order sentence so the details are filled out for us. And we're also going to do a BMP, the AM as well. Once I've added those two orders to my scratch pad, I'll click Done. And notice I have missing order details on both of these orders. It looks to be the same, which is our supervising physician. So today I'm going to actually grab my top order, hold down my mouse, and slide my cursor over all of the orders with the missing required details. That allows me to be able to put in this supervising physician one time. Go ahead and search for him. And it fulfills the needs of both orders. So it just saves you some extra time and clicks. While I have those orders highlighted, I also want to save those as my favorite, so I don't have to find CBC and BMP every single time, because it's something I seem to be doing a lot on my patients. I'm going to right click, and when I right click, I get an option to add to favorites. Notice I still have both of those orders highlighted, so they would both be added to my favorites. I anticipate that I'm going to be making a lot of favorites, so I want to add a new folder. And I'm going to call this one AM Labs. You can call the folders whatever you want. You can also choose just to kind of put it into the general favorites folder for yourself and not have those subfolders, but that's whatever works best for your workflow. So I'll click OK. So notice at this point, let's say you've got some extra time and you're creating favorites. You could choose to actually refresh and not sign those orders. I'm going to click yes to cancel my actions. And when I go back to my ad, I go to my star, which is my favorites. I have now a new folder called AM Labs. And when I select that, I have those two orders that I added already pre-selected to the AM one-time collect. So I'm going to order both my BMP and CBC. I have my supervising physician charted because that's the same supervising physician I've used since I've logged in. That was not saved as part of my favorite. And I'm going to go ahead and sign that order, or both those orders. and I'm going to refresh my chart. The other kind of order I'm going to show you here when I click add, when I want to point out are our diet orders. So for a regular diet or a diet adult, I can actually just type in diet and it'll pull me up all of these order sentences. I could also type in regular, and because it's part of my order sentence, if I hit the enter button, I'm going to see all the orders that contain regular, but this diet adult regular would pop up for me as well. So the search works off of the order itself and the order sentences. So I'm going to pick that diet adult, regular adult. And notice within here, you have options for any sort of your modifiers for your diet, whether you need a diabetic diet, a renal restriction, a fluid restriction, any sort of swallowing compensations. And anywhere it says multi, that means you can use the control key on your keyboard and actually select multiple items within this drop-down menu. One thing that isn't in here, though, are any supplements or snacks that you might want to order for your patient. So I'm going to type in supplement, hit enter, and go to this oral supplement adult. This is where you would order a Juven or Boost or another dietary supplement. The reason we don't order it within our diet is because it doesn't go to our dietary system, and so then often patients would be missing their snacks and supplements. So I could say I want an oral diabetic supplement, BID with meals, and then that gets delivered with their dietary tray, so they're not missing that extra nutrition. I've signed those orders, and I'm going to hit refresh. I always hit refresh after I sign, just so I can see the most accurate and up-to-date information. So I'm going to go to this medication list next, and I've decided that I want to reorder my aspirin here. I decided that I want to order a different dose on that. So what I want to do is I'll right click, and to order a different dose, we want to do a cancel reorder. What this does is it actually keeps the order from its original order state and then stops it from when you want to do the change. If we did a modify, it would modify the order from the beginning of the order, which is really confusing, especially with medications. So we just want to keep a proper record that we're canceling the old order and we're reordering something. So on this aspirin, we've decided instead of BID, instead of daily, we want to do it BID. So I'm going to change my frequency to BID. I'm going to click on my orders for signature button. And when I do that, notice that it has the old order of the aspirin 81 daily crossed out. And I have my new order of the aspirin 81 milligrams BID as the new option. This little exclamation point indicates that the schedule of the aspirin may not be exactly what you want. You can click this review schedule option, and it just shows you that the first dose is going to be at 2128 and the next dose at 0900. So you could choose, if those administrations were really close together, you could choose to skip the next administration or to alter the time of one of those as well. We're going to leave it as is because 2130 is pretty close to 2100, so we're going to hit sign on that. All right, and again, like I said, I want to refresh, and that shows me that it's taken off my old aspirin order of daily and just has the BID. So when I click this medication list tab, it actually also took me to this medication list item in the menu bar. Two different ways to get to the same list here. It's basically your orders view of simply all your medications. So we're ready to do our progress note for this day. So we did our note from the provider view from the M page, but you can also do kind of an ad hoc note as well, straight from documentation. So I can click my add button here in the menu, or I can click my add button once I'm in documentation. Maybe looked at my list and noticed that nobody else has done the progress note today. Here you do need to make sure that you select your appropriate note type. Today we've chosen, right now we're doing a progress note. We're going to do our note template of cardiology. Progress note. I went up to my search window here and just started typing cardiology to find those notes. Notice that you also have some stars out to the left. So if you did use a note pretty frequently, you can star it and then it'll be in your favorites so you don't have to search for it every single time you ever come into the chart. Once I found the note I want, I'm going to double click on it, or you can single click and click OK to open that note up for editing. So I've got my tagged text that we did with the radiology. And I want to make sure to bring that into my note. And I'm going to put it under diagnostic results. I'm actually going to add a free text with the arrow right here. And I'm going to pull this tag text in by grabbing it from my window with my mouse and pulling it over into this free text section. Once I've got it into that free text section, I'm going to unclick my mouse and it drops right there. You can edit this once it's in here as well. Maybe I want to label this as chest X-ray. And then anything that you tag will have a little footnote on it, which will tell you who originally was the author of that documentation piece. So go to your subjective heading and let's talk about SMART phrases and auto. If I do the /, so the slash that shares a button with the question mark, I have an option to pull in patient-specific data. So maybe I want to go ahead and pull their code status in here, and I double click on it. I'm going to acknowledge that my auto text may be different between solutions. And it pulled in my code status of full code along with the header. Other things that I can pull in if I do my slash, for example, is allergies. So you could search through your list, or you could start typing what you're looking for. Seems to have lost my mouse there, /ALL, and then hit enter once you found the one you want. So those slash phrases are really nice because they pull some patient-specific data. The dot phrases that we talked about earlier, for example, for a review of systems, so I use my period and I start typing ROS. That's where we can get kind of those pre-canned responses that are not patient-specific. So again, I'm going to edit that my patient does have chest pain. Right now, let's say I got pulled away to go help with a patient. But I'm not done with this note. I'm going to hit save and close. I have options to edit my note type, title, and date here. I'll click OK because I didn't have anything I needed to edit at this time. And when I click on my cardiology progress note, I can refresh and it'll unitalicize. The italics just mean that it was a new note added to the list. Notice that it says preliminary report and the result status is in progress. Any notes that have been saved and not yet signed are going to be marked as a preliminary report. To edit it further from here, we can simply double click on it from the list, or we can click this option to modify document up at the top. Either one will open the document up for re-editing. So if you've saved it, you can edit the entire body of the note. We can realize that in our ROS that we said they had chest pain, we didn't add our no back in, chest pain, but no complaints of palpitations, syncope, etc. We've reviewed the note and realized that there is nothing else in here that we want to add. Maybe we want to take out these headers for these diagnostic tests that we didn't perform. So we'll simply click the X next to that header. And we're going to sign and submit this note. At this point, you do have an option to forward to your attending provider, or you can choose to do that at a later time. We're simply going to sign right now. Once you sign, that preliminary status has now changed to final report, and your result status is authorized verified because you are an authorized user of the system and able to type these notes. So if I determine I need to edit this note further, but I've already signed it, I can still double click on it or hit your modify button, but you're limited in what you can do. Now, once I've opened this note, I can go back up here and highlight certain items. So let's say I didn't check the endocrine system, so I don't want that as part of my note. I can highlight that area, but my only option is to actually do this strike through. When I select strike through, it turns that option red and puts a strike through the text. Then you have an option to insert an addendum in the note. Right now, I'm just going to put that I did a correction of review of systems, endocrine system not reviewed at this time. Once again, I'll click sign to sign and submit my note. If you did have to go back in and make a revision on a signed note, you will have a big header at the top that says the note has been revised and contains an addendum. And you can see the strikeout information along with all the way at the bottom, the signing trail and the addendum. But we're having a really bad day and we went in and did this note several times and then realized we're actually on the wrong patient. So we need to in error this whole note. We need to take it out of the chart. If you realize that a note's been documented on a wrong patient, there's no way to officially delete it from the chart or a way to erase it, but we can in error it. So while we have our cardiology progress note highlighted, we're going to click this in error button with the exclamation point. By clicking that, I have a comment box open, which is optional, and I can say wrong patient, incorrect information, whatever's appropriate. I'll click OK. And the note will still view on the list even after I refresh. But the difference here is that if I go to click on that note, I get a warning before I go in saying it's been marked as an error. Do I want to continue viewing? And if I say yes, there is a big red sign at the top that says in error report and why it's in error. Well, it can't come off the record because of tracking purposes in case anyone were to have made medical decisions based off that note. We need it in the patient's chart for tracking, but it will have an in error documentation there. The other thing that you can do with these notes is actually create your own auto text. So I'm going to open up a free text note and just give a brief example of an auto text that you can create. So you could do this in any note. I like to do it in a free text note because it gives you more flexibility. I'm going to click on the Manage Auto Text button, which is at the end of your toolbar within the note, and it brings you to your Manage Auto Text page. If you wanted to see all the phrases that were already built in our Cerner system, you would click on Public Phrases and you could see all of our different options that we have already in the system. If you go to My Phrases, this is where you can add something custom. We would click our Add button. You'd create yourself an abbreviation, And we typically recommend not to use a dot or a slash simply because there are so many phrases with that symbol. And if you're creating your own custom stuff, you want to be able to find it quickly. A lot of people like to use the number sign or hashtag, and today we'll just call it test. So we can start saying, maybe you have a typical statement you use with patients, or you're seeing the same type of patients. You could say, patient seen with attending and all systems reviewed. This isn't a great example because you obviously want a more detailed note, but this is just for training. You can actually also create drop downs within your free text note, auto text note, by using this far right button here. I'm going to do it. I've typed that, and I'm going to say, maybe I don't want to say all systems reviewed. Maybe I want to say primary systems reviewed or pertinent systems reviewed. So I can double click on this word all, and I'm going to click on the create drop-down list option. So I'm going to say, as my second option, I want pertinent. I'm going to say systems review, just to keep with our scenario. And I'm going to hit create. Once I'm done editing my auto text, I'll click save. I'll close this box. And now I can do my number sign, pull up my test, and there's that auto text that I created myself. That drop-down list is available for me to choose my options, and then I would complete my note as normal. You can edit these auto texts that you do yourself as well by going back to this manage auto text, choosing your previous item that you created and clicking edit. There's also an option now to share auto text between providers, but we don't have that built in our test system. So you'll just have to ask around once we get out there. I'm going to cancel out of this free text note and discard my changes because I don't want to keep it on my patient's chart. So now we've kind of re-reviewed the chart, and we've talked about how to add, edit, and in-error notes. We've also talked about doing orders and one-offs. We've talked about power plans and reviewing patient results. The next thing we're going to talk about is basically going through a patient discharge. So we're going to go back to the provider view. We're going to go to the discharge workflow page. Just like your inpatient workflow, you have different components here to help guide you through discharging your patient and creating your discharge note. The difference here is that you will see some red starred items. These are items that need to be on the patient's chart prior to their discharge. So we're just going to go through and complete our discharge in page and our note and our discharge order. You can edit this screen as well. And let's say you always want to make sure that you address your home medications first thing. I'm going to add that all the way to the top of my list. To edit your discharge home med, we're going to click on this discharge medrec link. And we're going to now see an option for any prescription meds in the middle. So we still have our medications to continue. We have our medications that the patient should stop. And then we have a third column for creating new prescriptions. So we want to send a script for the metoprolol. So I'm going to click in that middle radio button there and wait for the system to process my details. I want to click on the metoprolol. And here I get an option to fill out my missing required details for my script. My missing detail, if I hover my arrow in the middle here, I'm going to drag it up. And I see that my missing detail is my routing. So I'm going to route this to other to be able to print this prescription. So I want to send it to a printer. And when I do that, I have other output devices as an option. This is where we're going to find our prescription printers. I'm going to scroll all the way down to my ULH University Hospital. I'm going to hit my plus sign again, just like we did with our patient list, and I'm going to find that 7 East patient. When I find a 7 East nursing unit, actually, it gives me the prescription printers that are on that unit and gives me the ability to select that printer. If this is a printer I'm using often, I can right-click on it just like I did with my orders, and I can add it to one of my favorite printers, so I don't have to search for it every time. Now, in our live environment, if the patient had a preferred pharmacy listed in their system, you could actually electronically prescribe the script to the patient's preferred pharmacy. So we'll click OK today. And we're going to continue there. Go ahead and continue some of their home medications. We're going to have them continue their Plavix. We're going to have them continue their Lasix. We want them to do aspirin, 81 milligrams BID. And then once after that processes, we're actually going to say that we do not want to continue remaining orders. So I have a count in my bottom left that says how many unreconciled orders are listed, but I've reconciled the ones that I know I want to. So I'm going to say do not continue the rest, and notice that it marks the rest of those in the red column. I'm going to reconcile and sign. The reconcile and plan option is only if you feel that you're going to have to come back and do a re-reconciliation of the patient's meds. Maybe you're on night shift and you're not sure if the patient's going home yet, so you don't want to address prescriptions, but you do want to go ahead and address any medications that they aren't going to continue. You now get your green check mark next to your discharge meds. Anything that's written as a script will have this estimated supply remaining bar out to the right, as well as the little pill bottle next to the medication. Anything that's simply a continue home med will have the scroll next to it. Then under our chief complaint, we're going to keep that chest pain, which is over from our previous documentation. Under our documents, I'm going to select my admission H&P, and I want to tag the HPI. So I'm going to highlight it and hit my tag button. I want to be able to pull that into my discharge note. I'm going to close this document with the X. In my labs, I want to tag my last proponent by simply clicking on it and hitting tag as well. And close this again. Under my, this labs flow sheet is simply another way to look at your labs. Under my discharge diagnosis, I'm going to add a discharge diagnosis of chest pain. And now it is only dull chest pain. Notice that I had this marked as a this visit diagnosis, so it's going to, or this visit option, so it's going to mark it as a diagnosis. Anything that's chronic is their history. Under discharge orders, I can start typing in discharge orders, or I can go to this admission folder and actually quickly find my discharge orders power plan. Once I've selected that, notice that the green shopping cart is now active. So I'm going to click up here and I'm going to modify my order details. I do want to bring my supervising physician in of my test cardiologist. And I would need to fill in my missing required details. So this patient's going to be discharged to home. I'm going to right click on my discharge general instructions to modify it. And I want to see a little more space on this order detail, so I am going to drag my screen up a little higher. The discharge activity is activity is tolerated. My patient doesn't have any restrictions on lifting, wound showering instructions, so I'm just going to right-click on my discharge and diet instructions and modify. Let's put them on a healthy heart diet because we don't want them having additional chest pain. And then we can scroll through here to see any additional items that may need to be documented as part of your patient's discharge. Anything that you document via this discharge power plan will actually flow to the patient's DPART paperwork as well, which is why it's really important to use this plan and not use ad hoc orders. We'll click Orders for Signature to view those orders we're getting ready to place to send our patient home, and hit Sign. Now we're going to get an error on this patient because admission orders have not been co-signed by an attending. At this point, the system will not allow us to discharge our patients with orders, so we will have to contact our attending to get them to co-sign that admission, and then we can come back in and complete our discharge. So we always want to check to make sure that that admission order is co-signed prior to getting our patient ready to go home. So unfortunately, we'll click OK here for today and move on with the rest of our discharge planning. Under patient education, we have some suggested options based on the patient's diagnosis. So I want to add some non-specific chest pain easy to read to my patient's chart. And once I click it, it'll mark it as added. And under this added medication, I can now see the leaflet. If I want to see what that actually contains, I can do modify. And it'll bring up the edit screen where I can see what this easy to read chest pain item is. You can actually edit any of this information as necessary. So let's say we want to make this text red and we want it underlined too, so they know to make sure you understand these instructions. I chose orange apparently, red, there we go. And we can hit sign and those modifications will save on the chart or on the patient's medication leaflets. These leaflets will print with the patient's discharge paperwork that the patient adds. Then we go down to our follow-up documentation. We can click on the location button if we don't want to search for a particular provider, or we can keep it in the provider field if we want them to follow up with someone specific. Today, we just want them to follow up at a clinic, and we want them to follow up at the AIM clinic. So I'm going to type in AIM. I get my ULHCerner cardiology clinic that I'm going to select. And when I do that, I'm going to scroll a little further down. It pre-populates the address of the clinic, the phone number, and then we have a time frame. So you can choose within 2 to 3 days. We could say in 1 week. Or we can be as specific as a date. We also have some predefined comments here that we can use. Or we can say something custom. So, all clinic with first available provider. Once I've added the appropriate information, I'll hit save. And again, in both the follow-up and the patient education, you have favorite options to make your discharge process a little quicker. In our hospital course, we're going to say a summary of the patient's stay. So, complaining of chest pain on admission. elevated troponins, but EKG unremarkable. Patient refuses further testing, but agrees to monitor at home. Chest pain complaint is now dull pain only. So we'll save that item. You can also run your Casper, find your Casper information here, run that report here. You can see the medications that your patient's taken, the histories that have been recorded throughout your patient's stay. Last vital signs will be in here as well as eyes and nose, and any pictures that were taken during your patient's stay if they had a wound or other remarkable sites would be captured here. So we've gotten to the end of our in page and we're going to create our discharge note. Most of the information in our discharge note does not pull over from the patient's chart other than those items such as medications that they're going to go home on, any pending labs, blood products, diagnostic results. But we chose through some trial and error to keep a lot of the stuff pretty free text, so that way you can populate your note and enter information in as appropriate. Notice that this BMP and CBC that we ordered are still pending, so they are going to show up as pending labs that maybe your patient needs to follow up on. So we had a troponin that didn't pull into our routine labs that we had previously tagged, so I'm going to drag that over into my lab section so that we can see their last troponin level. I also, on their admission H&P, have that patient history. So I'm going to pull that into that brief admission HPI presentation. And then anywhere, maybe I don't want to have that tagged item that it came from the admission H&P. If I do any sort of editing in this note, it'll actually undo that tag. So that may or may not be good for you. We just want to make you aware of it. Now we do have all these underscores built into the note, and anytime you hit F3, it's going to take you to the next underscore. So I can enter my discharge date of today, and then hit F3 and start typing in my physician. My F3 to do my service. Not sure I should be a cardiologist if I can't spell it. Maybe I didn't have any consulting physicians. Again, I can remove that section. My primary discharge diagnosis is that dull chest pain. I did not have any secondary diagnoses. We're going to follow up with the AIM clinic, and they're going to call for their appointment. I could also fill in my patient's discharge condition. I'm going to say stable. My discharge disposition is stable. And my plan is to follow up in clinic, patient to self-monitor. We've completed our discharge note, so we will sign and submit. We are going to go ahead and forward this to our attending, because we know that our cardiology attending wants to receive this note for cosign. And we're going to sign it. That's it. So we've completed our discharge information. Last thing we'll do before we exit our chart is actually exit through the door, and that will quit our application. So one last thing I'm going to show you is this Cerner reporting. This is where we can do another type of physician rounds report. And once it pops up, I just want to show you what this reporting tool looks like in case you need it once you are out with patients. It does take a minute to start up on first use, but typically gets a little faster as you access the portal. We're going to select all organizations. And then when I search in here, I can type in rounds or rounding, and I'll have a physician rounding report that I want to star as my favorite. So when I click run on this report, oh, I don't have the correct submissions because this is our test account. But basically it would, again, just like the physician handoff, show you your patient list and you would select them. And this physician rounding report is nice because it shows you the patient's last labs and vitals and their medications and a little patient summary as well. So just another report that you can use. So back to documentation as well. Let's say on that admission H&P, we didn't forward it to our provider to co-sign because we didn't know the name of our attending for the day. It's getting ready to go into a new day. We can actually, from this documentation tab, we can select a note and we can do the forward option to a provider. So I'm going to forward it to sign. We always want to make sure that we have it forwarded to sign to our providers. And I can type in that test KY cardiologist. If you've used them recently, it'll pop up as your favorite. And hit OK. So 2 ways to forward your documents. You can do it from here or after you've created and signed a note. Submit a note. You can put in your provider's name. Again, we want to make sure that it defaults to the sign option. So I'm just going to cancel out of that. Just wanted to reiterate because that is something that people forget when they're first out and about. All right, well, thank you for joining us, and we will see you in class or hear you in class very soon. So we're going to exit through the door and log off for the day. Thank you. Bye-bye.